You're listening to Healthcare Now Radio. Stand by for This Just In, the latest in healthcare innovation and technology trends with your HIT advisor, Justin Barnes.
Thank you very much, and welcome to the special edition of This Just In Radio Show at HIMSS19. I'm your host, Justin Barnes. We're broadcasting live from the HIMSS annual conference here in beautiful Orlando, Florida. But I'm very excited to introduce my very first guest, Dr. Bob Monteverdi from Lenovo. Welcome, my friend.
How are you, Justin?
Please come on in, join the show.
How are you?
Fantastic, and I'm excited to have here and be our fifth year in a row. And I appreciate all your partnership and your support, my friend.
Ditto here.
So tell me, first of all, what are you guys looking forward to for HIMSS19 specifically?
Oh, just a great show, good attendance, a lot of fantastic educational sessions. Sat through a few this morning already. Looking at the newest trends that are going on and trying to figure out how we fit into the equation. So happy to be here and just excited we've got such a big event again. How many attendees this year?
I want to say it's going to creep up towards 40,000.
40
is the number I was told. Yeah,
it's come a long way.
It has. I think when
back.
I first, I think it was around 8 or 9, maybe 7 or 8,000 when I first started coming. Maybe it wasn't even that much.
I think this
5,000.
is my 16th, so it's been a while.
Awesome, very cool. So now going into some of your thought leadership, what are some of the healthcare trends or even IT trends that you see in the industry?
You know, the one that I always grasp towards, because it seems to be the primary one that's driving everything, is just this whole cost-quality equation that's going on in healthcare. I continually, when I speak, I talk frequently about the cost of care being just ridiculous figures. 20% of our gross domestic product, $3 trillion a year, and how do you drive that equation down? And in recent years, it's been more value-based care has been the phrase that everybody likes to use. Yeah. How do we make that move gradually away from fee-for-service and more towards outcomes-based? It's really what it's all about. It's about the patient aspect of it. So as I look at that and I see all the risk being transferred from payers over to providers and over to patients, it becomes a different model out there, right? It's not so much about always filling beds. It's about trying to figure out how to get that best care and best outcome. And when you talk best outcome, the big change in recent years is it's not the best outcome by the provider's definition. It's the best outcome by the patient's definition.
So true.
Are they satisfied? So to me, it starts with value-based care, but that risk transfer drives this whole consumerism game, and that is the big patient centricity that everyone is trying to figure out how to solve. A variety of different means of doing that, but that's my 2 cents.
No, I love it. So let's actually dive in a couple of, in that component, what do you think are 2 to 3 best practices that you can offer for people to navigate that successfully today?
Yeah, at the highest level, whether you're a vendor that's actually marketing to health systems, or you're a health system and the end, the patients are really the end target, you're trying to figure out what the need really is. Look at that landscape and try to figure out what you can do, what's going to be your strategic competitive advantage to play in that space. So if centricity around patients is really the goal and trying to get the best outcomes you possibly can, well, what do? For the last few years, I've seen more and more of the bigger entities going down the advanced analytics path and artificial intelligence. Absolutely a great play. Takes time to accumulate the data. It's a lot of heavy lifting. It's one really good, strong play that does make sense. Another one I see that we're involved in a little bit more here is the virtual care telemedicine play. And you look at the ability to decrease the burden on physicians, to increase the convenience and the access for patients, to get potentially better outcomes, definitely more capability of monitoring all the wealth of devices that are surging out there, both consumer and medical grade. And I view that as a play that really makes an awful lot of sense too. At the end of the day, from a strategic perspective though, you really have to figure out, as I started to allude to, external market, your internal capabilities, and then a little bit of Stephen Covey into the mix doesn't hurt here. 7 habits. Begin with the end in mind. I mean, what are you trying to accomplish? What's going to be your advantage? What do you want to do? And then, okay, so where do I start? Put first things first. Be proactive. Make sure it's a win-win. It's got to be a win for your health system, but it's also got to be a win for the patients. So, sounds simple, difficult to execute on.
It's very difficult.
But that's my approach to all of these things, regardless of what I'm trying to tackle.
Well, and I love it because we are starting to tackle some of those in our think tank. We have Think Tank 5 here tomorrow, and we are starting to tackle some of those. So it's very exciting. So now thinking beyond today, What do you see as a key strategy or trend that we must be ready to successfully navigate in a couple of years from now? Because right now, a lot of this is the here and now. But let's think ahead. Let's think, in the Wayne Gretzky terms. Where's the puck going to be in 2 to 3 years from now?
I don't know if it's 2 to 3. I might be going a little further on you. Yeah. Obviously, artificial intelligence probably as big a play as anything, because if you're going to accumulate all this data, and even if you're going to apply all analytics to it, you can't have humans intervening with this volume of data. We start talking about real-world data and social media and then IoT externally from these remote devices. It just gets out of hand. So AI should be able to play a good role. It already is starting to, but
sure.
It's got its detractors and it's got its parties that are fearful of it, but it brings a lot of value to the table. I think ultimately, though, if you look at the whole consumerism play not going away,
right.
Healthcare is becoming
building every day.
Yeah. It's building. Patients and consumers now have the ability to decide where they're going to spend their money, their HSEs, their higher deductibles. They're making decisions that they're not getting necessarily reimbursed for by a third party to the extent they used to. So now you go out and you buy health care for yourself. It's not that much different than any other major purchase. Home, car.
So true.
It's a big
sort
deal.
Of $10,000 deductible or more.
Right.
So, yeah.
So what does that all point to? I mean, personalized medicine, precision medicine in the end game. 2 to 3 years, probably a little optimistic, especially if you include genomics into that mix of precision medicine. But ultimately, it's not really about just providing generic care to the masses. It's about providing the right care for Justin, for Bob, for everybody, more specific to what's normal and abnormal for them. And that's going to be a big, longer task, probably further out than 2 to 3, but I think that's where I see things going.
Well, I love it. I mean, starting off with the artificial intelligence and kind of where the here and now is today, but it is certainly in the future. But even where Andy Bartley from Intel had mentioned in our last think tank that they're actually finding physicians wanting to be trained on AI.
Yeah.
That's pretty fascinating, because actually I would not have guessed that. I mean,
and there's some real world stuff out there
now.
And, analyzing the diagnostics on the radiology, tumors for dermatology, and sometimes the results are coming in better than the doctors could diagnose, which is a problem in itself for acceptance. But there's a lot there.
No, and then also I think on the precision medicine side, one of my guests today, Evelyn Gallego from HHS, is going to speak to actually social determinants of health, which really is moving down the side of precision medicine.
Right, absolutely.
And actually I spoke with our former ONC coordinator, Dr. Karen DeSalvo, 2 days ago, and she's working heavily on this front as well.
Yes.
And so it is where we're going to be in 3 to 4 or 5 years from now, but it is certainly starting today. Yeah. So I completely agree. So what are you looking for? What's the rest of the afternoon look like for you? Meetings?
A lot of meetings. You knew that one.
Yep.
Got a couple of different things I'm doing at some other booths around here, some panels I'm on, and try to engage at the kiosks here as well. But excited about some of the offerings we've got, and just looking forward to engaging with folks, getting lots of good feedback, and keep making our offerings better and better.
Yeah. And what's the big theme? We'll touch on it a little bit at 3 p.m., but as we close this segment now, what is the theme that you think Lenovo will be investing heavily in 2019 and 2020?
I think it's some of the ones we touched upon. Obviously, we'll continue to make our hardware improve better and better for healthcare specifically. Moving a little bit heavier into radiology, definitely into virtual care. Trying to strengthen our already robust virtualized desktop infrastructure solutions. So it's a number of different plays, and actually trying to come to the market more one Lenovo with our servers and our clients together. I think all of those are factors in where we want to go.
One Lenovo.
One Lenovo.
I like that. That's good branding.
Yeah, it is.
Excellent.
I'll run that by them in marketing.
Cool. Well, Dr. Bob, thank you very much, my friend.
Thank you
Always
so much.
A pleasure. So, first of all, Dan, CEO of Strata Decision Technology. We're longtime friends. I'm trying to think back. I guess I met you in 2004, 2005 when we were starting the EHR Vendors Association.
Yeah, trying to create standards for electronic health records. Who would have thunk?
Amen. And we just actually walked through a lot of that with Adiv and Anish.
Yeah, so now there's actual data, so there's a different problem to solve than there was back then.
Yes, and actually we'll have at 3:50, Elise Sweeney Anthony will be joining us from the ONC talking about the new information rule.
Don't hype other people while you're talking to me. That's not right. Come on.
They were a last-second ad. I'm very happy we made it happen. But thank you. Dan, I love what you're doing. You actually, my very first guest brought up cost accounting. So I'll give you 30 seconds before I ask you some of the thought leader questions on your new cost accounting model that you've just launched.
Yeah, well, it goes back to what you and I and the work we were doing with a bunch of other folks 15 years ago on electronic health records. If you don't know what an EHR is, and you can't define what the data would actually be, then there's not anything to use. So now we've solved that problem to some extent on the clinical side. But on the cost side, it's essentially a black hole. I mean, people do not understand the difference between cost, price, charge, and reimbursement. If you look at bottom-up costing in healthcare, for the most part, it doesn't exist.
Right.
So if we're really going to look at value, we need to look at the top part and the bottom part of the equation. The model we launched with the Healthcare Finance Management Association yesterday was based on work we've done with over 200 health systems. There's 40,000 members in HFMA.
Yes.
So there's a real good opportunity for that industry to step up and really show the path on how we can get good, actionable information on cost to healthcare providers.
It's excellent. Isn't there a lot of money to be made by not wanting to tackle that, though, by a lot of different actors in the healthcare system? I love what you're doing, but I feel like there's people who like to have kind of that black box and not understand pricing or want to understand pricing because they make more money off that. Because I just waved into the insurance world or walked into the insurance world in one of my latest ventures, and I'm trying to solve that and fix that from a care provider standpoint.
Yeah, well, I mean, it all depends on your lens, right? Yep. So if I'm the CFO or CEO or a CMIO for a healthcare delivery system, let's just say it's $1 billion healthcare system. 80% of that cost is going to come from the decisions that the clinicians and the physicians make. So they have $800 million in their hands,
right?
But they have no idea the difference between one decision they may make in another. So we're not giving them any information to know if that glass of wine they're drinking is $10 or $300. And wouldn't it be nice to know? Because ultimately we're all stewards of the resources that are used within healthcare. So no, I think healthcare providers have nothing but the right reasons to get the right information right now. So
good. So looking at HIMSS and also what you're doing in 2019, 2020, what health IT trends are you seeing in the industry?
Well, I think this is the big trend right now. I mean, I think. Well,
I would agree.
One of them I would say is getting information that's contextual. So I went to the MIT Sports Analytics Conference, and at that conference, they're all talking about using data within direct context. So there's a batter that's up there. The pitcher has to make a decision where they throw the ball. There's a manager who's going to position their players on the field. In healthcare, we have all that information hiding behind somewhere. And when we present to people, it's really a bunch of information with some analytics tools that are looking to find one diamond in the rough versus putting direct data that's what's referred to as applied analytics, contextual data directly in the hands of people. That ultimately is the only reason why cost accounting data would matter is if you put it in the hands of people who can actually make decisions.
That's exactly right.
So. That's the trend I see is we've created this mountain of data, but we've got to get it within context. It's not just the tools, it's putting it within an appropriate context that's going to make the difference.
So following that context, what are 2 or 3 best practices that you could share with my audience on how you'd successfully engage that or navigate that outside of your cost accounting model?
Yeah, absolutely. So like one of the things you can do now within Epic is you can embed cost within order sets. So at least when I'm making that decision, I'll use the analogy of a glass of wine. At least I could see what the difference is. Yep. We tell every CFO it's a very easy decision to have with your clinicians, which is don't ever make a decision based on cost. I mean, it could be my wife or my daughter or my sister or my mom. Don't ever make a decision based on cost, but you should never make it completely oblivious of that either.
Correct.
So I think getting that data to physicians, whether it's prospectively, retrospectively, or in real time, all the data will show you it absolutely has an impact. So I think there's multiple best practices. The main thing is action, is actually doing something and engaging clinicians in a collaborative way. What's happening now is that people will send out a variation report between a bunch of different providers and show you as the outlier, and it starts as a very negative conversation.
Right.
There's a much
Very
better way
true.
to engage physicians in a collaboration. I'm talking to a bunch of CMIOs about that during this conference in a collaborative way where we can really make a difference. I think there's those are some of the examples I guess I would share.
It's excellent.
Yeah.
So now thinking a couple years in advance, say 3 years in advance, what should this group, because a lot of us we're focused on here and now, certainly with HIMSS because we're here. But what are you thinking in a couple years from now that we need to really think to navigate, or even in cost accounting in your world in several years from now?
Yeah, so I'd go back to the EHR days. The conversation that we were having 15 years ago was people were telling us doctors would never use computers. They were technophobic, right?
Yes.
So apparently technophobia was cured, or that assumption was wrong. The second thing was those EHRs had order sets in them. And with those order sets, people viewed those initially as cookbook medicine. Doctors won't use that.
Right.
That's cookbook medicine.
Yep.
And apparently that was solved. So I think on the cost side, if you look 3 years from now, we'll see why in the world weren't we sharing this information? It makes absolutely no sense. So if you have a $3.6 trillion spend in healthcare,
Right.
and $2 trillion of that is flowing through hospitals and healthcare delivery systems, that means $1.6 trillion can be attacked to some extent.
Totally agree.
By engaging clinicians in a productive, prospective way. And so it just, the problem to be solved, I think, is pretty obvious. But I think there's a behavioral psychology component to this.
Yep.
I think there's a trust component to this where people have to not assume, but they have to engage. So I think it's not just data, it's not just systems, but it's really about thinking through the problem in a different way.
Yep. No, and even to your point, we actually had a little bit of a breakthrough in Georgia a couple of months ago, actually a couple of weeks ago now, with the healthcare system that I'm a chairman of. We have full price transparency. We follow a DPC model. About 250 provider specialists will support that model, but then we finally have been negotiated with payers. They actually gave us a 20 to 30% credit for each member because of price transparency. Because our care model is proven to actually keep a patient healthier. Our DPC doctors practice at the top of their license. We integrated all of that and really dropped costs dramatically. And literally a 20 to 30% reduction in premiums.
Right.
For doing that. And so you just mentioned that one, was it $1.6 trillion we probably can take right off the bottom if we start.
There's any organization you go into, the cost of variation, is at least 10%.
Yeah.
So if you're in a $3 billion organization, there's a $300 million opportunity.
Yep.
So attacking that is not just a data problem. There's a way to engage. So Yale New Haven Health is a good example. They drove out $150 million of cost just by marrying clinical and financial data together,
yeah.
right? And then I think you and I have talked about this before, but they also did gain sharing with their physicians. So if you're going to engage as a doctor in the first year, why not let you benefit to some extent from it, because we'll get the benefit in the out years. So there's different ways to tackle the problem.
It's excellent.
Yeah.
So what else are you looking forward to in this conference? What do you have to tackle for the next couple of days here?
Geez.
You guys have a booth here, right? Of course.
Yeah, we do. But HIMSS is always a little bit of a zoo. So I'm actually spending time just having conversations with people. I'm going to be writing an article which is called the Solving the $3.6 trillion Problem, right? What here actually is helpful, from that perspective, which isn't just adding costs, but is going to help us run and operate, the responsibility we have to serve patients more efficiently and effectively. So a lot of the conversations I have are just about the problems people are trying to solve. Yeah.
Well, once you're writing, is that going to be an article that you're going to write or a book that you're writing? I would love to have you certainly on the radio show for that, because that's I love that conversation, because recently I realized that before I didn't believe we could really bend the cost curve very much, but now I really I see that we can bend the cost curve. And so that's a conversation that I'm fully involved in, and I just would love to have it with you.
Yeah, we'll see. If I can find your email, maybe I'll send you a copy. We'll see, Justin. But appreciate the opportunity to catch up.
You got it, my friend. Thank you very much, Dan, and good to have you on air. My next guest is the one and only Ed Marx, Chief Information Officer for the Cleveland Clinic. Welcome back to the show, my friend.
Thanks, Justin. I'm glad to be part of it.
Well, again, thank you very much. And I know that you have a very busy schedule, so we truly appreciate you taking the time to join our show as you do every year. We're grateful for that. But what healthcare or health IT trends are you seeing in the industry?
I'm really focused on two or three. The first and foremost being patient safety and quality. So that's the heartbeat of what we do. And so some of the trends I see is just how do we provide safer care and at a higher level of quality. And I think that we are able these days to leverage technology to really help address that particular trend, if you will. The second is really the acceleration of mergers and acquisitions. And again, there's a huge technology component to successful M&A. And I see that as a pretty major trend, not just in the provider side, but you're seeing it in the PBMs and payer side as well. And then finally, the third major trend that I'm really keeping an eye out for is really the patient experience. So that's everything from, of course, customer service, but also on the technical side, it's really enabling that experience to make it what they expect it to be when they interact with other industries. And so healthcare, as you and I have spoken about in the past, a little bit behind. And so we got some catching up to do. And so some people might call this the quote unquote digital space, but I think of it as patient experience. So those are the three that come top of mind.
No, that's excellent. Patient safety and M&A and patient experience. That's terrific. Spot on. Your perspective is terrific. So thinking about those three components, what are 2 to 3 best practices or strategies that you can share to help others navigate those trends?
One that I think we sometimes overlook is really humbling ourselves and looking outside of our own industry and looking at best practices. So for instance, on patient experience, I'm meeting with the Cleveland Indians CIO because the Cleveland Indians have done a great job connecting with their fan base. For a small market team, Major League Baseball team, they have one of the most expansive customer engagement. Their reach is pretty amazing for a small market. And so why have they been able to do that? What are the things that they're doing from a technology point of view? So I'm learning from him. And so that's just one example. Another is with analytics. I'm learning from Progressive. So Progressive Insurance, very strong, robust insurance company, and they do their lifeblood is really analytics. So why not sort of reach out to other people outside of healthcare? So that's one thing. The second is within healthcare, of course, we have great peers that we can reach out to, and I always encourage that, whether it's through a HIMSS forum, a Chime forum, and there's some smaller things. Like recently, we gathered with other digital leaders at Stanford and really shared. Each organization was there to share one best practice. And so it was a very small, intimate group of 20. And so we learned 19 other best practices that we can apply. So those are 2 examples of how you can really leverage best practices or learn strategies that can help your organization.
Wow, that's fantastic, Ed. And you're spot on. I actually created a think tank a couple of years ago, and that's exactly what we do is we get together facilities of all sizes and organizations, innovators of all shapes and sizes, payers of all shapes and sizes, other key thought leaders, and really bring them together to share their best practices. And I love your idea of bring one to the table that really has helped your organization. That's terrific. So I certainly wrote that one down. So now, thinking beyond today, what do you see as a key strategy or trend that we must be ready to successfully navigate in 3 years from now?
So I think one is voice. So to me, voice is the new mobile. Yep. Just like we're all hot and heavy about mobile, and for the right reasons a few years ago, and certainly that has come true. Everything has moved to the mobile and really transformed the way that we deliver care. And I think the next step is voice. So I think we'll no longer use the word mobile because that's just the standard, that's the expectation. And so it'll really be more focused on voice. And we're seeing some early things, right? You see it on the consumer side. And then how do we take all the work that's being done with voice and then applying it to healthcare? So we really need to be ready. And just a simple example, I mean, this is really simple, but I think sometimes you just got to start simple. I've given all these tools and technology to my wonderful administrative assistant, and I've asked her to create our office as completely voice. So that's just, it's small, but I'm telling you, you got to experiment yourself in order for you to come up with working with your colleagues, working with your clinicians and everyone in your ecosystem, sort of as what we consider a team of teams, and explore these different areas because they give you new ideas. So if you can handle voice at home, voice in your car, voice in your office, you now have somewhat of a base to go out and look at it in a clinical practice along, again, with the appropriate clinical personnel to really see what we can do. So that's just one thing in terms of where we're going. I think, and I'm sure other guests have really insightful answers here, and I'm trying not to duplicate any other. So the one other I might suggest is virtual reality And so we're doing a lot with virtual reality. I don't know if you saw the full face transplant case that was released recently through National Geographic, but these amazing clinicians that I get to serve with, they leveraged virtual reality to help them. In our medical school, we're cadaverless. We are moving to paperless. And the amount of virtual reality that, again, some very fine, innovative, wise people are developing here, would just blow you away. And then the other thing, as a third example, is just how we take virtual reality also, like working with our local zoo and allowing some of our pediatric patients the experience of hanging out with an elephant or a giraffe, even though they're in a patient room. So those are just some things that are sort of in the early stages today and are going to move forward quite rapidly in the next 1 to 3 years that we all need to be keeping an eye out on. And then when I say that, it's like, start experimenting now. Right. The examples I gave, other than the one with the face transplant, that was very complex and education. But the one with the zoo, not so complex. The one with just enabling your office to be voice, not complex. And so everyone can start now. That's what I love about some of these more simple examples, is get started now so that you're ready as technology matures or the organization matures or the business case, clinical cases open up. Grab hold of this now so that you're ready to help lead.
Ed, that's fantastic. And I completely agree. I have actually taken, I don't say bit the bullet, but about a year and a half ago, I decided to really make voice as integrated into my workflow, my daily workflow as possible. And so now, I've really trained my phone, my home, my entire house is voice activated and voice automated. And you're right, it's actually not difficult. It just takes if you take a little bit of time, do a little bit each month, and these products get better too. Where Siri is today, yep. Siri was not a year ago or 2 years ago. And just exactly. The accuracy, and all products are moving in this direction. So, or at least most of them.
Yeah. And it gives you a base then when you work with your clinicians that you have this experience. You may not be the world expert on it, but at least you're using it. And it just provides that credibility. And again, it stimulates innovation because you start thinking, oh, what if this worked this way for a clinician and help reduce burnout? So it's really important that we all grab hold of these things and just start experimenting ourselves, no matter how small.
Yeah, I completely agree. And actually, one thing you made me think of in the think tank, our last one, we actually brought up voice first, not voice only. So to begin, we encourage our providers inside the think tank to really go back. We gave them several examples that were live care providers doing today on how to navigate with their care plans, navigate certainly with their patients. But really, the mantra that we said is voice first, but not voice only. And so you get people beginning to engage, but it's not the holy grail. So.
Yeah, I love it. That's great.
Excellent. Well, Ed, I truly appreciate your time. As always, my good friend, Ed Marx, Cleveland Clinic, and thank you very much for joining our special live episode from HIMSS19.
And for everyone listening, thank you for joining us today. And please tune in weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me on Twitter at HIT Advisor and use the hashtag ThisJustIn so you can respond to your comments from the show. In addition, all my content's always posted on my website at justinbarnes.com. Thanks, everyone. Have a terrific week.